Morning, Cabinet Secretary. Initially, my questions follow up from Miles Briggs on testing. Cabinet Secretary, on January 30th, the New England Journal of Medicine cited the case of a Chinese woman who'd infected 8 people in Germany before becoming symptomatic. All told, there were a further 7 global alerts about patients passing on the disease before the onset of symptoms during February and March. Cabinet Secretary, the international health community was screaming about asymptomatic transmission, yet your government accelerated the decant of 1,300 patients from hospitals where you couldn't understand the spread of infection into care homes without a COVID test. Why did your government ignore those international alerts, and who was ultimately responsible for the decision to decant so many patients into care homes whose COVID status was unknown?
Cabinet Secretary.
So I want to make a number of points in response to Mr. Cole-Hamilton. The first of those is that I would not personally use the word decant. I think people were moving from a hospital setting to what I would anticipate is a homely setting, just as they moved many of them, the majority of them, to their own home. And we've already rehearsed all the factors and the reasons around that, and indeed noted that at the time, there was cross-party support, I think it would be fair to say, for that approach by government. In terms of international alerts, health alerts, we've said that there was and remains dispute in the scientific and health community about asymptomatic transmission. And if we look at, for example, the World Health Organization's daily COVID report on the 2nd of April, it says there are few reports of laboratory-confirmed cases who are truly asymptomatic. And to date, there has been no documented asymptomatic transmission. So there's a lot of discussion and debate around this. What we expected, and I think it was reasonable for us to expect, was that our care homes were operating to that manual of infection prevention and control, as they should have been doing for all other infections, including flu. We set out the guidance on the 13th of March that was very clear about the mutual clinical risk assessment before anyone was discharged from hospital to a care home setting, and all the steps that we required the care home to undertake. Testing is, of course, important, but what a test tells you is that you are positive on the day that the sample was taken. Isolation for 14 days, as we required at 7 days and 14 days, proper infection prevention and control measures, the correct use of PPE, all of those are the steps that are required to prevent infection spreading. So one on their own will not do that for you. And of course, as we know, whilst the PCR test is very robust in detecting the presence of the virus when someone is symptomatic, it is less robust in detecting the presence of the virus when someone is asymptomatic. And there is a difference between being infected and infectious. A difference that work continues to go on to try and understand exactly what that difference is and whether or not it is of a sufficient margin that we should pay attention to it in terms of our guidance and advice or not.
Alice Cole-Hamilton.
Thank you for that answer, Cabinet Secretary. You've lent a couple of times on the suggestion that these issues had cross-party support at the time in the foothills of the crisis. That may be true, but we didn't have the wealth of scientific advice that you were privy to. We were only given what was filtrated and had been decided upon, and obviously we were given scientific evidence to back that up. Can I also remind you, press you to answer my question about who was ultimately responsible for the decision to move patients? But before I get to that, in those months of high infection, you already said that government policy remained to test only those in care homes who exhibited symptoms, and you maintained it was largely futile to test those who did not seem unwell. That's a point you've largely reiterated in that answer. But we now know that the PCR test does readily pick up COVID in asymptomatic patients. Indeed, we learned yesterday that 45 members of staff at Renaissance Care tested positive despite not having any COVID symptoms. So when the decision was taken not to test asymptomatic patients before their transfer to care homes, what empirical scientific evidence was offered to you or your advisors that the PCR test was ineffective?
Call the Cabinet Secretary, and then I will move on to Sandra White. Cabinet Secretary.
So to answer the last part of your previous question about who is responsible, I am responsible. I don't think there is any doubt about that, and I would never prevail against that. Of course, these decisions sit at my door, and I have done my very best to explain them. In terms of the PCR test for asymptomatic individuals, I don't believe I have ever said it was of no value. What has been said is that the degree to which its value was considered appropriate has changed over time, and we know that it is less robust in detecting the presence of the virus and whether or not that presence is there from someone who has already had the virus and there is a degree of viral load left in what is being detected, or whether they are pre-symptomatic of having about to develop the virus. And I think from memory, although I'll be happy to provide this for the convener later, from the Chief Medical Officer, his point about the PCR test in symptomatic individuals is 93% accurate in terms of detecting the virus and 100% accurate in terms of detecting this particular coronavirus. In asymptomatic, the percentage is significantly lower, round about the 80s from memory. But again, if that is not absolutely accurate, we will let you know. In terms of the information and the evidence, I have quoted some from World Health Organization. There is other, and it develops over time in terms of what the World Health Organization is saying about testing of asymptomatic individuals from that quote that I gave on the 2nd of April through until later, where there is more evidence pointing on balance to the value of testing individuals when they have no symptoms. And of course, that is what has taken us to the decision to test all care home workers, regardless of whether they work in a care home that has an active case or not.
Thank you very much. And I call our final